Following a recent outbreak of meningitis in parts of the UK, the Ennis GP Dr Máire Finn is urging parents to stay informed and recognise the early warning signs of this serious illness. While the HSE says there's currently no indication of increased meningococcal disease in Ireland, cases remain at expected seasonal levels, 12 reported so far this year compared to 60 last year. The outbreak in Kent in the UK, where 27 cases have been linked to a university and 2 people have died, has raised awareness of how quickly meningitis can spread and why early detection is crucial. Máire, a very good morning to you and thanks for joining us on this important issue.
Not at all. Good morning, Alan. How are you?
I am very well, but I'm sure I'm concerned, as I'm sure many are, hearing the story, and I suppose given our proximity to the UK. What do you make of this meningitis outbreak in Kent, and how worried should we here in Ireland be?
Well, we shouldn't be any more worried than you would normally be aware. Do you know, like this, what happened in Kent is actually a localised issue, and you know, there's no reason to expect at all that will have a direct effect on anybody here in this country. However, it is what can happen with meningitis and meningococcal disease in particular. It was one of our greatest nightmares when I started working first, because it was the pre-vaccination, and there's 2 kind of groups of people that would actually be very much at risk of this: the young children and then teenage early adults as well. And, you know, so any child that would have like very high temperature, flu-like symptoms, they could potentially have meningococcal disease. And it was always a very scary thing. And when it progresses, then they can have a very distinctive rash and stuff. And, you know, so we would be very cautious about it. Now, the advent of vaccination has made a massive, massive difference in this. And the vaccinations became part of the childhood vaccination programme around 2016, I think. So we thankfully rarely see it in young children. However, these kind of older teenagers and would not have had that childhood vaccinations. So there's still pockets of outbreaks in university students in particular, because of how closely they will be in contact with each other. Now, that doesn't mean anybody should be overly scared by this, but if somebody has the symptoms, I suppose I should tell you, Alan, they are kind of flu-like symptoms, a headache in particular. A headache is a very particular symptom of meningitis, but meningococcal disease can actually be more than just that. So very unwell, fatigue, particularly a rash, all of those symptoms. And if somebody is just developing symptoms that would be akin to sepsis, which we've talked about before, which is when you'd have really feeling incredibly tired, your blood pressure is dropping, your heart rate is high, your pulse is high, your urine output is dropping, all of these things, you have to be seen as an emergency situation, and the meningococcal disease can be part of the reason that can happen. So I don't want to panic people, but I do want people to be aware of what's happening.
No, and being aware is important. And you mentioned some of the symptoms, the early warning signs, and in particular with the rash. Is it true that you shouldn't wait for that to appear?
Absolutely. The rash is actually a sign of septicemia. It's a sign that the bacteria that causes this has actually kind of gone into the blood. However, not everybody is incredibly unwell before the rash comes out. So it can be the first time that somebody would think about it. But the rash is very particular too. You might have heard over the years talking about, you know, using a glass to look at a rash, you know, those when you're putting pressure on a rash with a glass. The reason you do that is that this particular rash with meningococcal disease, it causes what's called petechiae or purpura, and they're bruises under the skin. And so it's not a kind of a blotchy rash. It's actually a little blood vessel that's burst. So when you put pressure on it, it doesn't go away. But you know, as a rule, if we have somebody who's unwell, has a rash, we want to see them as a matter of urgency, you know. And if you're in a situation where you can't get to a GP, you go to hospital in that scenario. So, like, I don't want to worry people, but this cohort of older adolescents, young adults who are in kind of like confined areas, meningococcal disease can spread very quickly in that kind of group, and they're not vaccinated. So that's why this has happened in Kent. And every year we do have kind of cases that will happen in a university setting.
And I guess when you see the rash, that's when you know it's time to seek urgent medical help. And patients, when they do have those kind of signs, Moira, can deteriorate quickly. Can meningitis progress in a speedy fashion?
Yeah, absolutely. It can be very, very quick. And, because the early signs will mimic almost everything else that causes head colds, flu, anything, it's very hard. You don't want people to panic over smaller things. But yes, if somebody has those symptoms and they progress into a headache that's severe, and then the other very classic thing with meningitis, that particular symptom, is that your head... your brain is surrounded by a thing called your meningism, and when they are infected or inflamed, it hurts to move your head and it hurts to bend your neck. So that's another thing that can happen, this kind of quite severe pain in your neck when you're actually kind of flexing. But yes, you can become really unwell very quickly. And I suppose, if it were to happen, frequently, I suppose there may be a place for the government to bring in kind of boosting vaccine programs for that age group. But what also happens, and what will be happening now currently in Kent, is that the public health will actually give out prophylactic antibiotics to all the other contacts. So they'll be given medication so that even if they weren't going to develop meningitis, but if there were any chance of exposure, that they will be protected and won't develop the disease.
Moira, who is at most risk when it comes to meningococcal disease? Are we talking about younger people, or is it regardless of age group or any other factors, you can be at risk?
As always, anybody who's vulnerable and who is on kind of like immune suppressing drugs or anything like that is going to be at risk of any infection. But there has always been kind of these two groups that were very much at risk of this. And there were young children, like I said, who are now currently vaccinated, thankfully, and the older teenagers. There was always these two groups that you'd have spikes of this disease. It can happen to any age group, but they're the two groups that we would most often be concerned about.
What should a parent do if they're worried that their child might have symptoms?
Immediate medical help if there's any concern. If this crosses your mind, and the symptoms are progressing in any way, and this is something different, you seek immediate help, either with your GP or in the hospital if need be. It's not something you wait around about. If something like this crosses your mind, it's like the way we talk about sepsis, if you have to have this kind of, it has to be there in your mind as being, is it sepsis? Is it a possibility? And if that's there and you have that index of suspicion and it crosses your mind and you think it might be, you look for help. You're never wasting anybody's time if you think it's something serious like that. We'd be delighted to tell you, no, actually it's something much more simple. So that's what I would advise parents or the teenagers or young adults themselves to do.
There is a vaccine for meningitis B, but not all age groups are covered. Can you just explain to us who currently gets it?
Okay, so there's meningitis C and B vaccines available. And there is other vaccines as well, but they're not on the childhood programme. So these are available on the National Childhood Immunisation Programme, a hugely successful programme and so important. And the Men B, I think, is given twice, maybe 2 and 6 months, and then a booster around 13 months. I'm not entirely certain about that now. The schedule changes a lot, but it's usually like that. And so it's offered to every single child born in this country. And thankfully, there is a very, very successful uptake rate in that. So, we do not see this disease in younger children, thankfully, anymore. But because it was only available since 2016, these older teenagers have not been vaccinated. And even though the incidence of the disease has reduced immensely because of the vaccination of younger children, it is still possible for the older ones to develop it.
Okay, how do you balance reassuring the public while also stressing how serious this illness can be? As you mentioned, what's happened in Kent, we shouldn't be unduly worried, but at the same time, people should get, vaccines and just be aware of the symptoms and just be as clued in as possible without being overly alarmed.
I know, and Alan, I suppose it's a thing I struggle with a lot because, often when I'm talking about things, it is usually in response to something that's happened that people are frightened about. So you do have to try and find that balance, and I believe education is key. Being aware of symptoms, being aware of something that is being for yourself personally or your children. If something is different, if your gut feeling says this is different, my child isn't doing well, I think that's when you seek help. That's what we're there for. You seek help and advice. And you do everything in your power to prevent illness. And that's where the vaccination programs come in so strongly. And, and I'm so thankful that the majority of Irish people are completely aware of this and are so well educated in this. And we have really good uptake rates. But, you have things happening in other parts of the world where, number one, you have people who haven't the infrastructure or the financial ability within a country to provide vaccination, so babies die all the time because they're not available to them. Or you have people who are anti-vax, which is a whole other thing. But thankfully, we stay informed, properly informed, stay educated, take note of the vaccinations that are available, take note of any public health information that's been given out, and trust your gut. I think that's the other thing I would always say. If you're feeling that this is different, if it's more severe, more sinister, you should seek help. And like I say, that's what we're there for.
Okay, well, look, we really appreciate you joining us, Máire, to highlight a really important situation. Thanks so much, and we'll chat to you again, hopefully. Thank you. That's Dr Máire Finn from the Ennis Family Medical Centre with us on Morning Focus.